Welcome to our Regulations video series. I'm Laura, your Customer Success Manager, here to guide you through the Health Insurance Portability and Accountability Act, or HIPAA, and what it means for healthcare providers, vendors, and patients when it comes to protecting health data. HIPAA sets national standards to protect health data and ensure patient privacy. It affects anyone handling medical information electronically. Let's look at its timeline. HIPAA was enacted on August 21, 1996. The privacy rule took effect on April 14, 2003, followed by the security rule on April 20, 2005. Breach notification requirements started on September 23, 2009. The law applies to providers, insurers, and vendors that manage health information. These are known as covered entities and business associates. Some businesses are exempt, such as employers using data for HR purposes or anyone handling fully de-identified health information. Covered entities must protect PHI in all forms, whether electronic, paper, or oral. They must use and share health data only as allowed by HIPAA, implement strong administrative, physical, and technical safeguards, train staff and enforce policies, and retain privacy documentation for at least 6 years. Website owners who collect health data must clearly post a notice of privacy practices if they maintain a website, explain how user data is used and what rights individuals have, allow people to access or request corrections to their PHI, use HTTPS and other secure methods for data collection, and limit the PHI they use or share to the minimum necessary. HIPAA requires written authorization from patients before using their health data for marketing, research, or other non-standard purposes. Covered entities must notify individuals of any breach of unsecured health data. If a breach affects more than 500 people, and both the HHS and the media must also be notified. Notifications must be sent promptly within 60 days. Businesses must respond to reduce harm and retain breach documentation. Individuals can access or request amendments to their data, get a record of who's seen it, and file complaints if their rights are violated. HIPAA is enforced by the Department of Health and Human Services, specifically through the Office for Civil Rights. Civil penalties range from $100 to $50,000 per violation, with an annual maximum of $1.5 million for identical provisions. Criminal penalties apply in cases of willful misuse and may include fines up to $250,000 and imprisonment for up to 10 years, depending on the severity and intent of the violation. Thank you for joining us. At Climb, we're here to help you navigate compliance with ease. Visit us at climb.io to learn more about our all-in-one digital compliance solution.